Hi all, myself Ananya Joseph, first MSc Biology, St. Mary's College, Thrissur. So we are dealing with the topic translational inhibitors. So first going to see what is translational inhibitors. The translational inhibitors are several antimicrobial agents that will inhibiting the translation process. It may be toxins, antibiotics, chemical substance, etc. So, the first inhibitor is the chloramphenicol. Chloramphenicol, which is derived from the bacterium Streptomyces venezuela. We all know that peptide transferase is an enzyme that will help for the peptide bond between adjacent amino acid. So, this inhibitor will binding to the peptide transferase and inhibiting the activity of peptide transferase. Chloramphenicol is a bacteriostatic effect. Bacteriostatic means after removing this inhibitor, the peptide transferase can function as normal during translation. The next inhibitor is the lincomycin. Lincomycin is derived from the Streptomyces lincolensis, which is also inhibiting the activity of peptide transferase, which binding to the 23S rRNA of the 15S ribosome unit. It affects both gram-positive and also gram-negative bacteria. The next inhibitor is the cyclohexamide or acetidione. Cyclohexamide is derived from the bacterium Streptomyces grassus, which is also inhibiting the activity of peptide transferase. Additional to that, it also inhibiting the activity of ribosome presented in the cytoplasm, which binding to 18S subunit and also preventing the movement of mRNA. Next are the inhibitors of translocation. Translocation is an essential step in the translation process. That is, during protein synthesis, mRNA and tRNA are moved through the ribosome by a dynamic process known as translocation. The first inhibitor is spasomycin. Spasomycin is derived from the Streptomycin spasogens, which inhibiting the translocation process. The next inhibitor is macrolides. Macrolides are derived from the Streptomyces erythraeae. These are active against the gram-positive and less active against the gram-negative bacteria, which binding to the 15S subunit of the ribosome and inhibiting the protein synthesis. They stimulate the dissociation of peptidyl tRNA from the ribosome through abortive translocation step. Next is diphtheria toxin. Diphtheria toxin is a exotoxin secreted by the Corynebacterium diphtheriae, which also inhibiting the translocation process. The next inhibitor is fusidic acid. Fusidic acid is a bacteriostatic antibiotic which is derived from the Fusidium coccineum that will altering the elongation factors. There are different types of elongation factors are presented in the translocation process at the step of elongation. So they will be altering the elongation factor and inhibiting the translocation. Next is inhibitors of amino acid tRNA. The first one is tetracyclines. It shows bacteriostatic activities against the both gram-positive and gram-negative bacteria. It prevents the binding of amino acid tRNA to the A site of 13S ribosome. It can bind to the both 13S and also 15S subunit. The next categories are inhibitors of polypeptide chain. First one is puromycin. Puromycin is derived from the bacterium Streptomyces alboniger. It binds to a peptide with the C terminus of growing polypeptide and also it results in the premature termination of polypeptide chain. This is a summarized table of translational inhibitors. Thank you for listening me.